All right, guys. So it is baseball season, softball season, and this is such a very common injury that I wanted to talk to you guys about. It is essentially what happens is guys like Jackson who are playing baseball, he's doing weight training, he's practicing all times a week, he's playing games on the weekend, he's just trying to better himself. And I know he has good coaches and he has great parents taking care of him, and so his mechanics are good. Mechanics should be something that you look at, but ultimately just the volume of what we're doing and the number of reps they're getting in is going to start to cause tension and injury to the tissues. And so what Jackson's feeling is he's feeling a lot of pain. Actually, he's feeling it right on the point of his elbow and a little bit above. And what's happening is he's just using the muscles over and over again. It's pulling on that tendon and causing a tendonitis. This could happen on the outside of the elbow. It could happen on the inside of the elbow. This is very common for throwers. So whether it be baseball, softball, they all start to get this with a large volume that's going on. And so what we want to do here is we want to provide some sort of rest. Rest can come in the form of treatment. Obviously, you could rest from the sport, but sometimes when we're right in the middle of the season, we want to rest smart. And what that means is we're going to pull back volume on non-game times, but then also pick up volume during games times. But for rest, as far as treatment goes, we're going to do a technique called active release technique, where we're trying to release any restrictions in the tissues. So for him, we're going to treat his tricep. So I'm just applying a pressure to his tricep and I'm going to have him move. We're just trying to treat right at that tendon and also the muscle in and around it. Obviously, if it was this part of his elbow, we could do passes here, but we're just wanting to push that inflammation out, take tension off the tissue by releasing the muscle and make sure there's no contracture in the muscle or the surrounding tissues. What we're also going to do, and you'll probably see this in this video, is we're going to do some ultrasound and some class 4 laser. The ultrasound is going to be great about decreasing that inflammation. The class 4 laser is going to get in there and actually help the healing process. It's a light that penetrates deep into there. So we're using sound and light to actually change the tissue structure and change the inflammatory process in there. What you don't want to get in the habit of doing is taking ibuprofen on a regular basis. And a lot of people don't know this, but ibuprofen, its mechanism of action is to stop this inflammatory process, which means it's stopping the healing process. And we don't want to stop healing. We want to control it. So if you're in the middle of a long weekend of baseball and you just can't perform because of it, that would be the time to potentially use the ibuprofen to get you through the weekend. But on a regular basis, you want to actually address the issue and get to the root cause of the issue so that you don't continue to perpetuate the injury and get worse and worse and worse. Hope this helps.